Okay.
Okay.
Good afternoon, everyone. I hope you had a good long weekend. If you work with the court, you also had Friday off. We've heard from our members, and a couple of them are going to be coming late, and one, Kimberly, has to leave at 1. So if you're speaking and I interrupt you, I apologize in advance, but I'm going to want to let Kimberly have a voice before she has to leave because she'll be here for a short time. And Fariba's emailed and said she'll be late. I'm wondering if we think we want to wait a little bit or if we want to just launch right in. So let me just check in and see. Justice Petra, do you have any sense?
I don't, because I also don't know the folks who are coming late, how much later they're coming, so I don't have a good sense.
Okay, Julie, do you have any, do you want to weigh in on that?
What's our agenda today? What are we discussing today?
So our agenda today is quickly recapping sort of what we've done and then go through the geography piece. Chris has a great PowerPoint and then a discussion about what our recommendations will be. We're working on a draft report that will be circulated with a very short turnaround. So we probably will fill most of the 2 hours. So maybe, and we have Sharon now, so perhaps we can get started. And sorry that I didn't.
May I take roll?
Yes.
Okay. All right. So you, starting with our chair.
Yep, here.
And Bashan.
Present.
Thelmuth.
Here.
Hamilton.
Present.
Kirkmeyer. Petru.
Here.
And Sarush. And we do have quorum.
Thank you so much, Christopher. And Kirkmeyer and Sarush said that they will be joining us. They're going to be a bit late, and Kirkmeyer will have to leave at 1. So I'm just going to check and see. We have 3 attendees and 1 person with their hand up. So should we go to public comments? And Jason Solomon, we're going to give you 2 minutes. Everyone will get 2 minutes because we have a pretty full agenda.
Jason, I just gave you permission to talk.
Terrific, thanks. Jason Solomon, Stanford Center on the Legal Profession. I think the plan for pilots generally on a great track. I just want to express concern specifically about housing as an initial practice area. I've alluded to this before and just want to make sure you have the most relevant information as you prepare your recommendation. So the HIL's report gave us different strategies for closing the justice gap, which the State Bar is now pursuing. Changes to the rules of professional conduct, a regulatory sandbox to experiment with non-traditional providers and new business models, and licensing new paraprofessionals, which is your focus. And experience from other jurisdictions shows that these are different strategies whose effectiveness will vary for different populations and different kinds of legal problems. A recent British Columbia report recommending the use of independent paralegals articulated well the specific role of paraprofessionals. Quote, "The problem faced by the justice system, to which the licensed paralegal initiative directs itself, is that a large portion of the public, A, experience serious, difficult to resolve legal problems and want help from a professional, B, have some money to spend, but C, are not getting help from lawyers. The problem is that housing cases, for the most part, and in contrast to family law, are matters where the people lacking representation do not, quote, have some money to spend. The one place in North America where we have experience with paraprofessionals doing housing cases, more than a decade of experience, is in Ontario. And the best available data indicates that paraprofessionals there overwhelmingly represent smaller landlords and rarely represent tenants. Again, in Ontario, which is where they've been doing this for a while, paraprofessionals overwhelmingly represent smaller landlords, rarely represent tenants. So if licensing paraprofessionals in housing cases is intended to help close the justice gap in California, I think our best prediction is that it is not likely to succeed. Indeed, it is most likely to make the problem of the gap in representation between landlords and tenants worse. Happy to talk about alternative practice areas or ways to include housing as a broader area of civil claims, but I would strongly discourage you from doing housing as a standalone practice area. Thanks.
That's so interesting. And thank you, Mr. Solomon, for that information. I'm wondering if any of the members of this committee have questions for Mr. Solomon. Would anyone like to hear more or have any questions? You said you had some thoughts about possible improvements or ways to address that issue. I'm going to exercise my privilege as chair and give you a couple more minutes to see if you would like to fill us in on that, Mr. Solomon.
Sure. So in Utah and Washington, I believe Washington before they sunsetted it, What the plan was to have sort of a broader group of kind of consumer financial issues, and including some of the other areas that you're looking at for the broader program. So not just housing, but also some consumer debt issues, healthcare, challenging billing issues. So there's sort of a range of financial issues. You could also have just a general kind of either limited jurisdiction civil or small claims kind of area that you could do, and housing could be a part of that. The other thing I'd say is, the folks in Washington look back and may second guess themselves on different things. The one thing I don't think they second guess themselves on is starting with family law. I think just starting with family law and getting folks in the court system in California used to the idea of paraprofessionals in just one practice area is worth considering. Obviously, there are trade-offs there, but it's worth considering.
Okay.
Erica, may I
Yeah.
ask a question?
Of course, Julie, go ahead.
Jason, I'm on the housing subcommittee. We've only had 1 or 2 meetings, maybe, and the last one was last June. I believe we begin our housing subcommittee meetings again on March 1, and I hope you will join in. As part of our research last year, we looked at the Shriver projects here in California, and we found that those projects are barely touching the tip of the iceberg in terms of tenants who need assistance in unlawful detainer proceedings. Do you disagree with that?
Totally agree with that. Totally agree with that.
Oh, okay.
The question is whether they have the ability to pay paraprofessionals, or whether there are other models that can be used to reach these folks, including allowing people who work at nonprofits, who have a bit of training, who may be social workers, who may be community health advocates, to provide very limited legal advice without going through a whole licensure program. So the key is ability to pay. Do we think these
Right.
folks really have ability to pay paraprofessionals?
Yeah, and I believe that's an issue that Sharon brought up in an earlier discussion. So, and we definitely intend to look at that.
Great.
Any other questions for Mr. Solomon? Well, I always find your comments and input very useful and helpful. So thank you so much, Mr. Solomon. We appreciate it.
Thank you for allowing me to speak.
Oh, thank you. Does anyone else who's an attendee wish to say anything? I only see Mr. Solomon's hand up. I think it's his hand that was up previously. Anybody else want to say anything? Okay, so then we can go to our agenda. And I want to just kind of start off by filling you in with respect to the timing and offering a bit of an apology and deep gratitude towards staff. So because we've been tasked with providing at least some report on February 26th, our committee has gotten the shortest timeline, and we've met 4 times already. And we are working on a memo that is in draft form because it will be filled in by what we decide today. That memo has to be posted on this Friday, the 19th. We think that the memo at the latest will get to you by tomorrow morning, the 17th. But we're hoping that people can look at it and review it and give their input to Christopher by the end of business on the 18th, so that he has time to get it ready the morning of the 19th and have it posted on the 19th. So it's going to be a pretty short turnaround. So you might get it on the 16th. Might get it on the 17th, have to respond by the 18th, have to post on the 19th. And I'll remind you at the end of this meeting. And we have a couple members who aren't here. Does anyone have any concerns or questions about the timeline? We're sorry for it. But Christopher did not have a long weekend. He worked all weekend on, the PowerPoint we're about to see, as well as the memo, along with Dwan and Leah. So I just really want to thank staff because they really made a heroic effort to get us this information. As you'll see in the PowerPoint, there's still some data points that have not been gathered yet, not from want of trying, but we just don't have it. But we do have a lot of information to share. So I'm going to turn it over to Christopher, who's worked on the PowerPoint and will take us through it.
Thank you. I'm going to go ahead and share my screen. Just
Thank
one moment. All right. Can you see the slides?
Yes.
Yes.
Great. All right, thank you. Good afternoon, everyone. Staff and staff have assembled this presentation with mostly data to guide the subcommittees, to help guide the subcommittee's conversation today about the geographic rollout of the ultimate program. So I'm going to walk you through the slides, and we're going to save ample time for discussion. That being said, please let me know as I go along if any of the data points jump out at you, you have any questions about them. We can take as much time as you need on each slide. So quick recap of the subcommittee's last meeting and its decision points. On February 2nd, the group reaffirmed unanimously that it was in favor of phased in implementation of the program rather than a time-limited pilot project. That is a pilot project that might expire or sunset. The group also decided unanimously to include family law as a practice area with which to launch, housing, and collateral criminal, specifically expungements and reclassifications. And the third area of consensus was that the activities within those practice areas that would be live upon launch, that those activities would be the full list of recommended activities from each of the substantive subcommittees that were looking at those areas of law. So for instance, the family law subcommittee's full recommended list of authorized activities would be the list to which the subcommittee would defer.
Chris, before you go on, I just want to note that committee member Fariba Sarouche is here now.
Oh, thank you very much.
Yeah, and thank you for letting us know you'd be late, Fariba.
Thank you. Sorry about that.
Thank you. Welcome, Fariba. We're just getting started.
Can I ask a question about this?
Yes,
Yes.
of course.
About that slide, if you go back, this collateral criminal, I just want to clarify because in collateral criminal, we had also, the subcommittee had also included representation in infractions. And that's not, is that intentionally excluded from what would be considered, or is that more akin to family and housing that all of the full recommendations would be included in the practice area?
Sharon, my recollection is that we're saying the full recommendation, but did you want to weigh in on the issue of infractions first before we go to others?
Yeah, we really didn't discuss that as this broader group, but I would say that for the time being, we would recommend everything.
Okay,
I
thank
agree
you.
with that. Thank you, Linda, for catching that.
Thank you very much. Okay. Okay, so also pulling from the subcommittee's most recent meeting, staff honed in on particular factors that would help inform a decision about geographic rollout where data was available to us on this timeline. And so for today's meeting, we were able to pull data for the following key factors. The first factor being the size of the potential client population upon rollout. And the data that we were able to acquire that was most on point was county population estimates from the US Census Bureau. The factor for potential participant, legal paraprofessional participant population upon rollout. The data that we had access to is county bar exam passage data from the State Bar of California. I'm going to have a couple of slides on this, but to preview it for you, it's those who qualified for and took the bar exam but didn't pass, who might be interested in pursuing a legal paraprofessional license. The factor for the size of the local justice gap, insofar as the program seeks to help close the civil justice gap, the data that we had that was on point is county level pro per litigant data from the Judicial Council, as well as attorney density data, county level attorney density data from the State Bar. And then the other factor that we had that came up on the second was implementation costs for a limited geographic rollout versus a statewide rollout. And those expense projections are going to be coming from the State Bar. So that's just to preview the data that's coming to you now. So for the potential client population, we looked at the population estimates for every county. We just, because we could only fit so much information on each slide, we wanted to put up the top 15 most populous counties in the state, and encourage the group to think about how if the county is too small, and the program does end up rolling out only in select counties, a very, very, very small county might yield very few paralegal participants, but also clients, which might suggest that maybe the program isn't that popular or it isn't working, when in fact, it was actually just a very, very small pool of people who could possibly participate in it. And then on the other end of the spectrum, if the county is too big, so Los Angeles County is the most populous in the state, there's the chance that it might leave too little breathing space, so to speak, for the program to develop its licensing and its discipline and its other infrastructure features in the very first year or two. So there might be a sweet spot in the middle, but you want to make sure you have at least enough people who will participate as clients or legal paraprofessionals. If I were to draw your attention to anything on the slide, I would just point out that the top five counties are all in Southern California, and Los Angeles is far above in population size all the other counties in the state. This is just a kind of an interesting thing to take away. Over 75% of the state's population lives in just 12 counties. Again, Southern California being home to most Californians.
If anyone has any questions or comments, just jump in. I have the panelist view open, but I can't always see hands. So please feel free to just jump in and ask Chris your question.
Thank you very much. And I encourage interruptions. So for the size of the potential legal paraprofessional population, the data we had available to us were bar exam scores. We looked at scores that were under 1390, since the state bar has in conjunction with the Supreme Court of California has created a pathway to licensure for those who scored above a 1390. And we have 10 years worth of data. So this is looking at 2011 through 2020 in order of county with the greatest number of potential legal paraprofessionals, those who might be interested, who did not go on to become attorneys. Los Angeles is at the top. Unsurprisingly, this sort of tracks size of county, the population data, but Los Angeles is the top, San Diego, Orange, and then it jumps up to the Bay Area. As we know, most folks who take the bar exam and those, as well as those who don't necessarily become attorneys, tend to live in urban areas. Similar slide, just showing that about 75% of the test takers who scored below a 1390 live in 7 counties. Greater Los Angeles area, Greater Bay Area, and Sacramento. So looking at the size of the local justice gap, the civil justice gap, we found 2 different sets of data that you can put together to kind of start to get a picture of what the civil justice gap might look like in each county. And we were limited to county level data. So we were able to get self-reported pro per litigant data in different areas of law from the Judicial Council. The area of law that was most helpful to this subcommittee's work was we were able to get it for family law, and since that was one of the practice areas the subcommittee was most confident in recommending for launch, we focused on that. 2017 was the most recent year for which we could get this family law data. Two limitations of this data set is that 13 counties, 13 court systems choose not to report their pro per litigant data. And so I've listed them on the right, and there's some notable counties. So Sacramento, San Francisco, for instance, did not provide data in 2017. So while you can still look at the other counties to see the extent to which they have a lot of pro per litigants, you wouldn't be able to say that a county has more or less than Sacramento or San Francisco's court system. The other caveat for this data is if you look at the column heading, I had to word it very carefully. I've worded it pro per litigants as percent of total filings in family law. So we don't have data from the Judicial Council that says this is the percent of total filings with at least one self-represented litigant. What we did have was these are our total filings, and here are the total pro per defendants, and here are the total pro per plaintiffs. So what we were able to run was a pro per litigants as percent of total filings, which is how you get these percentages that are above 100%. So what that's showing you is that since a single filing can have more than one pro per litigant, you can get above 100% of filings. The takeaway here is that you'll notice that the top of the table has some more rural counties, Central California. Eventually you start to get down to some of the bigger counties like Orange and Alameda. But again, Sacramento and San Francisco aren't on there.
Chris, quick
Yes.
question. Are you saying that there's no data on how many of these were lopsided cases?
So we were the data set that we received, say our staff received, just showed total filings for family law, both regardless of whether or not they had any pro per litigants in them, and then the total number of pro per defendants and plaintiffs. So we weren't able to infer from that, for instance, whether or not it was one party in a filing that was self-represented and the other one had an attorney. That would be the lopsided. We weren't able to extrapolate that.
And did you get the percentage for Los Angeles County?
We did, and I can pull that up on really quick. Can you see? My hope is that you actually can't see this table because it has one confidential data point on it. I think it's just on my computer, but I can pull the
we're still
percentage.
seeing the PowerPoint, Chris.
That's perfect. All right, so for Los Angeles County, 68%. 68% pro per litigants as percent of filings, which is why it didn't make this chart. Each table, it just has 15 rows, and then on the left you can see we've sort of ranked the counties, which is why at the very bottom there's 3 number 12s, as their Trinity, Imperial, and Tulare are essentially tied. But Los Angeles County would be 68%, so it would have fallen just off this table.
And Kim just joined us. So Kim, we're going through a PowerPoint to just set us up for a discussion on geography. Glad you can be here.
And
Welcome, Kim, and thank you, Sharon.
Sorry, Chris, is Santa Clara County right around 70%, my guess, or is that?
I have it up right here.
Thank you, Chris.
Let's see. Of course, yeah, and I'm happy to pull individual data points. 59% for 2017 family law.
Pretty low. I'm not sure if I want to discuss it here, maybe too detailed. I'm a little confused about, is it, how they came up with these percentages a little bit. So it's okay. We don't need to take time right now. Maybe we can have a different conversation.
Right. And one, I guess a third caveat would be State Bar staff, or maybe speaking just for myself, don't have all the information about the extent to which different court systems might be providing their data more or less rigorously, or if they're using slightly different intake mechanisms that might be more or less under or over reporting it. Unfortunately, that's something that we can't assess.
Because
I can't assess.
Just to clarify, this is the GIPSIS data that that courts are providing. There are detailed instructions on how to report the GIPSIS data, but the pro per data set is voluntary. So all courts do not have to submit it. So this is the best data that we're going to have. And Farida, to get to your question of how the math was generated, maybe Chris, you can just answer that. It's just a numerator and a denominator, and that's how the percentages were derived. You want to?
That's totally correct. So what we did is we took the total number of we added pro per plaintiffs and pro per defendants together, the number, and divided by total filings. So it's very simple. That's why this, ideally, what we really wanted was to know what's the percent of total cases that have at least one pro per litigant. But since we, it wasn't reported that way, we weren't able to run that percentage. Okay. Just to move us along, but if you have any other questions about this, I'm happy to come back to it. The other justice gap proxy that for which we were able to get some data is attorney density, just the ratio of county residents to active licensed attorneys who live in that county. So I have two tables here, one that shows counties that are, quote, worst off, and one that shows counties that are, quote, best off as far as attorney density from an access to justice perspective. So the counties that have the highest per capita disparity between residents and licensed attorneys, in order, starts with Merced, and then it goes down. So basically, to read the table, Merced has 1,791 residents per active licensed attorney. And I'll leave this up for just a few seconds so people can skim the list of counties. And since this is a lot of data to take in, staff do have a proposal at the end of how to take all of this data for all of these proxies, and staff have a proposal for a geographic implementation. So for those counties that have the lowest per capita disparity between residents and licensed attorneys, you might think of them as being better off as far as access to justice. Legal resources. San Francisco is at the top, 50 residents per attorney, active attorney, Marin, San Mateo, and then Los Angeles, Sacramento, Orange, and so on. With San Francisco being kind of an outlier, and it's particularly low ratio.
Are you going based on where the attorneys live, or where their offices are based, or where they practice? Because I know that some attorneys practice in multiple counties.
I think it's where they work. It's the address and correct me if this is wrong, Leah or Linda, but the address that's on record with the state bar is their work address.
That's right. Usually, usually it's their work address.
So Sharon, it won't take in all of those nuances because they could be practicing in obviously more than one county, but it gives us a general idea.
Okay. The third sort of access to justice data set we have that isn't really a table here, but it's really a visualization, is we know that from the great work of the Access to Justice, California Access to Justice Commission, that the legal aid resources in the state, that court programs and certified lawyer referral services tend to be denser in urban areas, especially the greater Bay Area, the greater Los Angeles area. So this is a screenshot from the Access to Justice Across California map that sort of plots by county where these four resources tend to be available. The thing that you can, really the only thing you can infer from this particular visualization of it is the concentration of these resources in San Francisco and Los Angeles. This is a great map if anyone wants to, and I have it pulled up on a tab if anyone wants me to show it later in the meeting, but it's a great way to just sort of see which legal services are available to very low-income Californians in each county. I'll invite my colleague Leah to present this slide. This is our final data slide.
Okay, so there were some questions that had been raised about the fiscal implications of a statewide versus a limited geographic rollout. And so I put this together really to kind of begin to address that question. And you've got in the left-hand column some of the key components. Really, these are the components of the program administration and cost overall, not necessarily specific to a pilot. And then I've identified if the cost associated with that cost factor is fixed or variable. And that fixed or variable is really what gets to the impact of a limited geographic versus a statewide rollout. So starting with the governance, overall governance of the program, estimating we'll have one staff kind of administering or coordinating that, the governance body, and that I see as a fixed cost. So it doesn't matter if it's a limited geographic rollout or a statewide rollout. You move into licensing, which I've broken up into two categories. So the curricular requirements, and the test development and the administration. So this is in large part variable. Specifically, if we start out with a small number of practice areas, we will obviously have less costs in terms of developing the curricular requirements and developing the subject matter specific exams. On the test administration side, because I think we're contemplating all online testing, I'm not so sure how variable that cost will be based on the number of test takers, but presumably there will be some difference based on just the number of licensees that you have. So you can see what I've estimated in terms of both FTE and contract dollar.
Leah, can I interrupt you? Steve has a question.
Oh, yeah.
What is FTE?
Oh, full-time equivalent, just a staff person.
Okay.
So basically, you know, I'm not specifying what kind of staff right now, but I estimating that we're going to need a staff person to handle these various functions.
Gotcha. What's the average cost per staff person when you do like 120, 150 a year?
I think probably the average cost is around 100 salary, plus a benefits and overhead factor that probably is close to 40%. Dawn is on the
40.
line, so that's probably about what we're talking. And if we're talking about an attorney FTE position, obviously the salary is higher, but these are not going to all be attorney personnel.
Thanks, Leah.
And then going into the other aspects of licensing. So there's going to be, I think, a significant workload associated with the admissions process. When we think about the licensing, the construct, there are educational requirements, experiential requirements, and there's the possibility to waive some or all or both of these kind of categories of requirements. And that waiver process will have to be handled by staff at the state bar, reviewing transcripts, reviewing work experience, and making a determination as to whether or not the request for waivers should be approved. So obviously that cost will vary in a limited geographic rollout scenario versus a full statewide rollout, because it's very dependent on the number of licensees. Regulation, this is maintaining records. So we were just talking about having attorneys have their address of record on file with the state bar. We publish the profile of the attorneys on the state bar. You can do a search for attorneys by name on the state bar website. All of that falls under regulation. So we will have to staff that. That cost is going to vary based on the number of paraprofessionals that you have. So as we move on down through these rows, you can see that the vast majority of these costs, in my view, are variable based on a limited geographic versus statewide rollout. We move into the discipline row, and you can see that some of those costs are fixed. Standing up the disciplinary panel, I believe that's a fixed cost, but the amount of staffing that we might need on the Office of the Chief Trial Counsel side to investigate and prosecute complaints will vary based on the number of licensees. Advertising, similarly, there are some fixed elements developing the copy and the content of the advertising and consumer education material, but the variable cost will be actual local market advertising rates. And certainly if there's targeted kind of social media advertising as well, all of that is dependent on geography and scope. And then the evaluation, this is one element I think that is specific to the pilot. There is an intent to evaluate the impact of the program, and that of course would vary based on the size of the rollout.
Any questions on this slide? Do you want to pause on it for a moment so people can just digest it?
I'm good.
I've got a question.
Yes, go ahead.
So I'm wondering, Leah, if you've run numbers for low end and high end scenarios just based on these variables. And
No,
a big visit.
I have started to, but I've not any that I would share. I can tell you I have in the rough recesses of my mind the idea that it's going to cost close to $1 million to stand up the program. When I think about test development, curriculum development, paying stipends to disciplinary panel members, adding staff, the evaluation, all of that, I think that's sort of the minimum of what we're looking at. But I really wouldn't be comfortable sharing a precise number now.
And do we have costs from other states, which of course would pale in comparison to a large state like California, even with limited geography rollout?
Well, we certainly can get the cost from Washington, which, were considered prohibitive and one of the reasons that the program was sunsetted. I don't actually have the applicable costs from other states in each of these categories, but I can work to get those.
Steve, thanks for telling me you were good. Anybody else have any questions or need a little bit more time with the slide? I'm checking, I don't see any hands. We can always come back to this in our discussion if we need to.
I'm sorry, I have one comment.
Go ahead, Julie.
I was just reviewing a letter submitted to us by Jason Solomon, and he interviewed Steve Crossland, chair of the Washington LLT board in 2021. And according to that person, there have only been 2 complaints filed against LLTs in 7 years, and both were dismissed. So the estimates on the discipline system might be overstated in terms of, at least in terms of Washington's experience. I'm not sure how reliable that is, but that's what he says.
Well, you may recall several meetings ago, Julie, in the discipline subcommittee, we did look at some estimates of the rate of complaints. Remember, there are only 40 licensed paraprofessionals in Washington state. So they received 2 for 40 licensees. I think that the most robust data set we have is out of Ontario, where they have 9,000 licensed paraprofessionals. And based on that data, if I recall correctly, there was a complaint rate of about 5%. So I think that it's safe for us to assume that would be our complaint rate, for lack of anything better to estimate the number from. That being said, I agree with you. I think it's likely, not going to be the case that we need 0.5 of an FTE in OCTC, certainly not for the first few years of the program. But because of the level of scrutiny the state bar is under with respect to the functioning of its discipline system, I think its attorney discipline system, it's going to be really important that the state bar can assert there is separately dedicated staff for the paraprofessional program, and that may be slightly over-resourcing it, frankly, at the outset. So these numbers, I agree, are likely high. Certainly not until we have 5,000 to 10,000 licensees. But if we use the Ontario numbers, I think that would be safe for us to assume that rate of complaints.
Okay, and I recall your discussion of that at the prior meeting. Yeah. And so these staffing numbers are based on your 5%?
They're based on a 5%, and they're based on basically having about, I think it was about 30 complaints that are being investigated at any one time.
Okay, thank you.
Thank you, Julie. Any other questions?
Hi, this is Kim. I do have one quick question. Leah, just in your limited geographic rollout, what did you consider for that? Because there's a large difference in your license compared to statewide rollout. So were you looking at like 3 areas of the state, half the state? What were you considering there, a third of it?
I was considering the actual recommendation that that we're going to share with you, I think, in the next slide.
Okay. All right. Sorry.
So that's a great segue, Kim.
Yeah, and a great question too, Kim. Any other questions? Okay, well, thank you, Kim, for the segue. We can go to the next slide.
All right. Thank you, Leah. So before staff present their proposal for the subcommittee's discussion today, we wanted to just pull out a few sort of like neutral geographic inferences. So some of these are a little more obvious than others, but if you're looking for really high level takeaways, the most potential clients are going to be in the counties that have the largest populations. So the 4 top ones are Los Angeles, San Diego County, Orange County, and Riverside County. The most potential, from the data that we have available, the most potential participants, clients, or consumers will come from those, the most potential legal paraprofessional participants will come from those counties that have a higher number of JDs who maybe didn't go on to become attorneys. And those are going to be Los Angeles, San Diego, Orange, Alameda, and San Francisco. Looking at the justice gap, high level inferences, we looked at self-represented litigants to filings and attorney density. And for this list that I have here on this slide, I just pulled out the names of the counties that had a population of at least 250,000 residents. And the reason I did that was some counties are so small in their population that their self-represented litigants to filings ratio and their attorney density ratio is a little skewed. And so looking at counties that are minimum size, the ones that have the highest pro per litigant rates in family law in 2017 were San Joaquin, Santa Cruz, Orange, Alameda, and Tulare. And then attorney density, again, counties of 250,000 residents and above, Merced, Tulare, Kern, Stanislaus, and San Joaquin. And then unsurprisingly, high level inference, it will cost less to roll this program out in select geographies than it would do it statewide. Okay, so staff have a recommendation for your discussion today, and that is to launch the program in a limited number of counties rather than statewide, to leave space to build out the licensing, discipline, evaluation, and other pieces of infrastructure. To launch in Northern California, Southern California, and Central California, to ensure that there's evaluation data coming from all 3 parts of the state, and there's a good mix of urban and rural settings. To exclude counties or substantially exclude counties with populations under 250,000, since it's very likely that they'll yield far fewer clients and legal paraprofessional participants in the program's very early years or first year, when participation will be heavily looked at. And to exclude Los Angeles, since it's so populous with over 10 million people that that county alone might end up overwhelming launch in the first year or 2. And if that one was going to be on the table, to think about maybe just doing it there. And to exclude San Francisco because of its uniquely high attorney density. So that's just an access to justice consideration. Now we've pooled a proposal for all 3 of these regions, a combination of counties. But I'll pause here for just a second to see if anyone has any questions about those inferences.
I have a question.
Yeah.
So is it contemplated that that the paraprofessional will be from that area and they could help people that have cases in other counties, or people in other counties that have cases in their counties? So exactly how are you limiting it?
That's a great question, and I'll name my assumption to date, which has been that it'll be the location of their practice. So so I'm going to defer to Dwan and Leah as well, and Judge Yu. But I was thinking that they would be allowed to serve participants from outside their county as long as their practice was located in the county that was authorized. But that is certainly an assumption I was making.
I think I was thinking they would serve clients in the pilot counties. So maybe slightly different than what you were thinking, Chris.
Yeah. And I'm not making an argument for mine. So.
That's a great question.
Yeah.
So the paraprofessional and the client and the case will have to be all from the same county.
Except where I think maybe we should look at our recommendation and talk about what might make sense, because we're actually recommending, you want to go to the next slide, Chris? We're
Yeah.
actually recommending some groups of counties.
And there's
Right.
a comment from somebody, it's someone in the attendees who
see
say
it.
Orange County sounds, Orange County sounds ideal. Go ahead.
So let me. So this piece is quick. We've selected counties that we think would work using the data that would work well using the data that is available to us today. So for Northern California, staff suggests Alameda and Santa Clara counties, and then as well as showing you the map, a slide that just kind of summarizes the reasons why. They're two of the most populous counties in Northern California. The two have a combined population of 3.6 million, just so you know. As far as size of legal paraprofessional population, they're in the top 3 in Northern California, with bar exam scores suggesting that previous test takers would be interested in pursuing this new license. Alameda County reports a high rate of self-representation in family law. So those are the reasons we picked those 2 counties. Again, we avoided San Francisco because of the high attorney density.
Quick question on that, Chris. So
Yeah.
Just with that assumption, high attorney density, it does not mean that because you have a lot of attorneys that they take low income cases or take reduced fee cases, right?
That's correct. Yeah, because that's looking at all attorneys.
Okay.
Yeah. Just to give you the full recommendations, you can have it. You can have it all in your head at once. For Central California, staff suggests Merced, Fresno, and Tulare. Fresno is the largest county in Central California. The 3 combined have a population of 1.7 million. Fresno is in the top 13 counties in the state, with the bar exam scores suggesting the test taker might be interested in becoming a legal paraprofessional. It's the #1 county in Central California. Looking at the justice gap data that we have, Tulare has the highest rate of self-representation in family, has a high rate of self-representation in family law. Merced has the lowest attorney density in the state. If you're looking at just counties that have a population of 250,000 or above, Tulare would be the 2nd lowest. And then to round it out, the proposal for Southern California, we looked at San Diego and Orange combined. We looked at the 2 separately, and we landed on not combining them and suggesting Orange County. It's the 3rd highest population in the state after LA and San Diego. It alone has about 3.2 million residents. 3rd most scores in the state after LA and San Diego for test takers who might be interested in becoming a legal paraprofessional. And it reports a high rate of self-representation in family law compared to Los Angeles and San Diego. It reports a higher rate. So that's the proposal. I will just, before we launch into before the chair opens it up for discussion, I'll just say that the next steps for staff are to gather additional data from about where certified paralegals live in California. That data would probably come from the ABA, and then to figure out from local legal services providers and local courts how they think, what they think about a limited geographic rollout, if that's what the direction the subcommittee goes, and that's going to be the result of today's conversation. So I'll turn it back over to you, Judge Yu.
Thank you so much, Christopher. We really appreciate all the effort that went into this presentation. Let me start though to see if there are any other questions or thoughts based on the slides we saw, and if anyone wants to go back to anything.
I have a question.
Yes, Julie.
So in Northern California, you recommended Alameda and Santa Clara. So does that mean that if a client lives in San Mateo County, agrees to go to the attorney's office in Santa Clara County, and all the legal work takes place there, but maybe some paperwork needs to be filed in San Mateo County, that's not legal? I'm just asking this question because I said before, and I'm still concerned that a limited rollout geographically creates a lot of confusion about who can do what where. And I'm still concerned about that. So I just want to get a sense of what you're recommending.
That's a good question, and it goes to Reba's question as well. And so how I'm thinking about it is in terms of data collection. And I'm not sure if that's the right matrix to view that question, but that for me is sort of how I've been thinking about it. And so for me, I was thinking that the cases would be situated in Alameda and Santa Clara, but the paraprofessionals could be situated outside there, and the clients could be as well. I mean, you know, they may have a marriage where they got married in Santa Clara and one person lives there, but the other person now lives somewhere else and they've gone to somebody. And
Yeah.
so they're all, it's very, we have porous county boundaries. So that's what I was thinking, but I have not talked to staff about it. It was my initial thought. So I'm wondering if staff wants to weigh in, or if our chair of the committee wants to weigh in. Anybody else?
I'm wondering if well, I guess I wonder how dispositive that the answer to that question is on the other question, which is, should we do a limited geographic rollout at all? And if so, what do you all think of the counties that we recommend it? Because I think it's a tough question.
Mhm.
So for example, I think the easiest, cleanest thing would be the paraprofessional has an office location in one of the included counties, and their clients are in one of the included counties. And the reason I say that is, think about the fact that not everything the paraprofessional is going to do will necessarily involve like a court filing. So if we don't have some kind of residency requirement, then you really are opening this up potentially to, it really is de facto a statewide rollout, because we can't just say the matter has to have jurisdiction in the Alameda Superior Court or Santa Clara Superior Court, because there may not be a court filing involved at all. So I don't know, to me, this cleanest is sort of residency or office location, both the paraprofessional and the client. I don't know if you all feel like that's too restrictive or not realistic given what you see, you know, as being the needs.
Yeah, I have a little concern about it being restrictive, Leah, in the sense that, you know, let's say there's someone who resides in San Francisco and works out of their home, as many people do. And I think we'll be doing even more so going forward. I have a hard time saying that because that person lives in San Francisco, they can't get licensed and can't help people in Alameda and Santa Clara County with their cases.
Okay, and then Sharon has her hand up, and Fariba, and then maybe back to Julie, although I'm not sure if that's a new hand.
Yeah, I'm going to push back on that, because if we're talking about family law, oftentimes you have cases where dad may be in Alameda County and mom may be in Merced County, and yet dad files and she has to, you know, maybe go back to the first county, and she would be limited if she was not a resident of that county. So I don't want to have, like, I would urge this committee to really think about any unintended consequences that may disadvantage low income and moderate income folks.
Do you have any recommendations based on what you said, Sharon?
You know, I'm percolating on this. Okay. I think that if we do go in a direction of limited geography, these are not bad counties to look at based on the factors you're looking at. I'm just like really trying to think about all the implications.
Yes.
Well, and going back for a second to what we were talking about with Leah's suggestion that it'd have to be in that county, and the concern that I heard Leah raise that not everything is a court filing. Of course, not everything requires a court filing, but is there some way to limit it to say that if something were filed, it would be in these counties?
Yeah, and I know Fariba, you have your hand up, but I wanted to just say, I think I'm agreeing with our chair, because if one of the matrix is going to be an evaluation, how quickly something went through, if they had to go to court or not, if the judges felt that, you know, there was help for the litigant with the paraprofessional, to me it seems like that case should be in that county, not the people. But Fariba, I'm sorry, you had your hand up, and thanks for your patience.
Thank you. Could you please go to not the next slide, the one after that? Doesn't matter, justifying why you picked this. Okay, so it seems to me like I was gonna say your selections have to do with the needs of the people in those counties, but then the only one that concentrates on the needs of the, not necessarily needs, but on the factor having to do with the participants, with the potential licensees, is the bar scores. So my point is that if the objective is to address the needs of the potential clients, and that's why you're mostly choosing these counties to roll out the pilot, then it seems to me like we have to concentrate on the clients, and that those clients from those counties may have cases in other, I know people who have child support cases in 3 counties, you see. So also to the point of our chair, that these days people having remote practice, they could live in San Diego and serve people in Santa Clara County. So I think in terms of what I'm recommending is, pick a focus point like needs of the clients. Okay, then we're gonna serve people in certain counties, and we don't care where the paraprofessional is from and where the case is, as long as the client is from the pilot county. And I totally get Leah's point in terms de facto rollout, statewide rollout. I get that, but I wonder if we can think about that some more, and does it really
if I could just jump in for 1 second, because I completely appreciate what you're saying about individuals having cases in multiple counties. I think part of the problem, though, is that we need to have the counties be on board, and we need to have the courts be aware of the program and get them on board with what is happening. I'm just a little bit concerned, being well aware that people have cases in many counties. I'm a little concerned about if we just limit it to where the client is living, that we don't have any ways to keep our arms around the scope of this limited rollout. I mean, it seems to me, and Judge, you can jump in as chair of the subcommittee, that there does, and I could be wrong, but there does seem to be some consensus, or maybe we need to clarify whether there's consensus, that we should not be doing a statewide rollout because it's too much. It's too expensive. We need some way to keep our arms around the initial phase so that we can gather the data, get the justice partners on board, have the courts on board. And with the need to have some limitation, I have a concern with saying that it doesn't matter what county the person has their case in, so long as they reside in one of these counties.
Yes, I think up till now, there was to me, it seemed like some consensus that we might look at a limited geographical rollout, but I take Leah's point, and if we did a statewide rollout, which I'm not saying we should, maybe we would look at one subject matter or something. But for now, I think we are looking at a limited geographical rollout, and the thought is, how will that hit the ground? What does that look like? And Steve had his hand up, so thanks for your patience, Steve.
I'm thinking that the rollout's going to be based on jurisdiction, because we need to have a clear defined geographical area where we're going to gather data from. So whether the parties living in that county or not, for example, because of the move away situations or parents living maybe in adjacent counties, for example, somebody in San Luis Obispo, it's not being considered, but somebody could have a case in San Luis Obispo, but just live 15 minutes away in Santa Barbara County. So I'm thinking they are allowed, the pilot program is going to be in the selected counties, doesn't require that the party be a resident of that county, just that county have jurisdiction of their case. And it doesn't require that the paraprofessional reside in that county, just that they're going to provide services there. We might get more participants in the pilot program if they're able to do their work remotely, even if they're not a resident of the county. Just a thought. I did have a question for Christopher, though, too. San Joaquin County looked really high in terms of the pro-pers. I understand they had more than 100% because they double report. Was that considered to be part of the central Valley, or why was it excluded as from consideration?
That's a great question. It might have been because of the population. Let me see.
Well, I think we were looking at contiguous counties. Is San Joaquin adjacent to Fresno? We wanted to anchor our kind of rural cohort with a larger county.
Oh, no, I
We
get
wanted to anchor it with Fresno, and we thought about contiguous counties. And I think the thinking was that there would be some movement between those counties getting to this conversation we're having now. We didn't fully articulate it, but I think that's why I picked Fresno as an anchor, and then some very high need smaller counties around Fresno.
Tulare, and what was the other one that you had with that group?
Merced.
Merced.
Okay. Okay,
Yeah.
then now that makes sense too. Because I'm thinking like the rural counties that are around San Joaquin, now you're getting into like the foothill counties that are going to have too low of a population to really support being in the pilot program. Thank you for explaining that.
That was right. Thank you, Leah.
Steve, thank you, Leah. I don't see any other hands, so I'm checking to make sure if anybody wants to jump in or say anything. I'm not sure we've answered our question though.
I just want to say that I would support giving special importance to bringing our justice partner, the courts, on board. And if that means that we are not going to limit where the geographical location of the paraprofessional, geographical location of the party client, we're just going to limit the geographical location of the case. I would not oppose, I would support that. I think that's a good way to limit this.
Yeah, what Steve said resonated with me when he said that county which has jurisdiction over the case. Steve, did you have your hand up again? No, okay.
Sorry, I didn't lower it. My bad.
Oh, no, that's okay. I just want to make sure if you had something to say that I didn't that. Looks like Sharon has her hand up.
Yeah, just to build upon that, I think that we're going to be successful if we get the courts, the self-help centers bought in, but then also legal aid organizations in those areas and maybe like other supporting organizations so that there is a robust referral system. I think a program like this is only as good as like all the entities that support this and are plugged in.
Yeah, very good point. Anybody else want to say anything? And also, if staff had any comments, please feel free to jump in as well. I don't know, for example, if Greg wants to say anything, or Donna or Dwan, people who haven't had a chance to say, Linda. Anybody want to weigh in? Oh, look, there's Julie has a hand up.
I just have a question for Sharon. You've said that term several times, a robust referral system. What do you mean by that? You mean referrals between paraprofessionals and legal aid and or places that might provide free legal services? Is that what you mean?
Yeah, so for example, if a client comes to a paraprofessional and they are not moderate income, they are low income, and the paraprofessional says, hey, you can potentially apply for legal aid, having a warm handoff would be ideal. But then I also am thinking about this from the point of view of evaluation, and having as much eyes and ears on the program in these jurisdictions is going to be really helpful.
Thank you.
Sure, thanks, Julie. Anybody else want to say anything or have any questions or wish to weigh in at all?
I just would love to think through a little bit more the recommendation that so the geographic limitation is only with respect to jurisdiction. Is it the expectation then that when the paraprofessional is contacted by a potential client, they will have to do some kind of jurisdictional analysis? And is that something that's easy to do? I just, those of you that know more about this than I do, I would love to hear you think through exactly how it would be effectuated by a practitioner.
Yes, they would. And it would come down to, is the child located in that jurisdiction, or is one of the parties located in that jurisdiction? That would give a basis to file there.
Yeah, and I was thinking, did you suffer a criminal conviction in Santa Clara County, which you now have to, have the record clearance? Then you'd be in Santa Clara County.
Okay, so it's easy.
I think so, but I'm not sure. Do you think so, Sharon? And Fariba and others who might be lawyers looking at this, do you think it'd be
I
easy?
think,
to
I
figure out?
think we're looking at venue more than jurisdiction. I mean, I don't do criminal law, so I'm not talking about the criminal piece, but we're looking at location of the court in the state. So the kids live in that county. For a divorce, one party resides in that county. So maybe there's an existing case in that county. And I mean, we're getting too detailed here, but if the case moves to another county, can the paraprofessional follow it? But I'll leave that alone.
Yeah, I think the family ones are going to be the more challenging because for the housing ones, it's going to be in that county. They're probably residing in that county. The collateral criminal, it's going to be kind of clear it'll be in that county. What do you
It's
think?
not a foregone conclusion, because based on Mr. Solomon's comments and then just also me thinking about this further from the last meeting, do we want to think about that some more?
Think about what? I'm sorry, I didn't hear.
Whether housing is a foregone conclusion as part of a pilot, considering that a lot of tenants are not going to be able to afford to pay for a paraprofessional. And not creating lopsided cases where we have the unintended consequences of, empowering landlords to hire paraprofessionals and then not having representation for low-income tenants.
My personal view on it is it really would be valuable to roll it out and collect data and see if in fact it's the case that tenants are not availing themselves of the benefit, because I know we have very limited data, not from our jurisdiction, and we have a massive UD crisis coming our way, and it's not all people who are low income and are going to qualify, certainly not all people who are going to qualify for free legal services. So I personally I don't see a real downside in including it in a pilot in a true sense of the word. And if we see there is the unintended consequence, we could make adjustments accordingly. That's sort of my view on it, for what it's worth.
I agree.
Yeah, that resonates with me. But anyone want to push back against that on the housing piece? Certainly, I think it was so helpful to hear what Mr. Solomon said, that we can be mindful of the issue and look at it when we evaluate.
Maybe not a direct pushback, but just a reminder that we are committed to being flexible. And let's say we get some early data that this is not working and it's having a bad consequence on low-income clients, that we have permission to tweak that and to fix it, because I don't want this to be on the backs of moderate and low-income folks.
And Sharon, just so I understand what you're saying, are you saying that we should watch how many lopsided cases are created because landlords can afford to hire paraprofessionals but not tenants?
Yeah, so what Mr. Solomon presented, and this may have been before you joined the call, Fariba, is that we have, there's data from Ontario that did roll out housing, and you had landlords that hired paraprofessionals, but barely any tenants. So that would create more lopsided cases, which goes against what we're trying to do here.
That was an experience that happened in another jurisdiction that Mr. Solomon brought up. And I think you might not have been here yet because it was during the public comments piece for Reba. So I'm so sorry you weren't here then. Okay, looks like we do have a hand up with Julie.
Thank you. Yeah, I am on the Housing Subcommittee. And as I mentioned, we've really only had 1 or 2 meetings. We've issued 1 report, which was on whether housing, and it's specifically UD, should be in or out in terms of further consideration. Since then, and that was last June, a lot of people have raised a lot of really good issues that we intend to look into as best we can and should have an opportunity to look into, including ability to pay on the part of tenants. And it was never our intention to exclude landlords as clients of paraprofessionals, but just to somehow limit them. But we just never got that far. What we were trying to do was show need at that time. And that's as far as we ever got. And we've never had another meeting, and we won't have one until March 1.
And maybe the housing subcommittee, thinking about this, will be able to give us recommendations that address the issue or try to account for the issue.
Yes, and we need to focus on these issues and try to focus on data that might help us make a recommendation. We just never got there. And I think based on the likely need that's going to exponentially increase pretty soon, we should probably take a good look at it.
And I know that Ira's listening in.
Yeah.
Yeah, that's great. Thanks, Ira. And then Julie invited Mr. Solomon to attend their meeting as well and comment. So any other thoughts or questions? There's some information shared in the chat too, if you want to look at that. And thanks to Mr. and Ms. Sampson for giving us his or her point of view. Anybody else? Okay, so then let me ask this question. Do we have some consensus around the fact that it would be an issue of venue, and that really what would drive it is where the case is located? Do we sort of agree on that? I have a sense that we were reaching some consensus on that, but I want to just check and make sure staff has a chance to be heard on that and everybody agrees on that, so that we can include that in the letter that we're gonna, or the memo that we're gonna write for distribution on Friday. Okay, nobody's saying no, and seems like we've got some consensus there. And so now let's talk about these potential recommendations, and if we could just kind of go to that slide. Thank you, Christopher. Okay, so for the first proposal for well, first we agree we want something from Northern California, Central California, and Southern California, that we want those 3 geographical areas. I see some nods, so I think that's agreed. Okay, so then let's drill down a little bit more. For the Northern California proposal, what do we think about Alameda and Santa Clara counties?
I think it makes sense, and I think we've got members of this working group that are in those jurisdictions in one way or another that would facilitate those being good pilot program areas to test.
Certainly those of us in Santa Clara would be fully committed to it, but we didn't have a hand in making the recommendation. But if the recommendation is adopted by the board, then, you know, I know Fareeb and I would do all we could to support it.
I figured you might know some people.
Yeah.
Objectively speaking, I am no longer in Santa Clara County, but I would say that Santa Clara County would be a perfect place, and good partners and court system there to test this out.
Anybody else want to say anything about Santa Clara or Alameda? Okay, so looks like we'll be putting that in our memo, and thanks for those comments. So we'll go to the next for Central California. This is the map, so I'm not sure if San Joaquin, I don't see San Joaquin there, so it's not contiguous. And let's go to the recommendation. So it was Fresno, Merced, and Tulare. What do we think about that? Please jump in or just raise your hand, whatever you prefer. And staff, please feel free to jump in as well at any time.
After hearing the explanation, that makes sense to me now.
I gave a thumbs up. Anybody else want to say anything? Okay, so we'll put that in our memo. And next is Southern California, and we know Orange. At least one member of our attendees thinks Orange is a great idea. But what about our committee members? Anybody have any questions or thoughts about Orange County? Like,
I know last time I was in favor of including LA County because I wanted to, you know, for evaluation reasons.
Yeah.
I have gone off of that jag based on data provided today. And I think that Orange County would be a fine county.
Thank you, Sharon. Anybody else want to say anything? You know, it's just so helpful when, even when we express agreement, so like Sharon did, so it's just really appreciative. I appreciate that. Anybody else want to say anything, push back on anything? Okay, so I anticipate the memo is going to come sooner than later because, you know, with it's just drafted with some placeholder information, and we're going to ask you to review it and turn it around and give us your valuable comments as soon as possible. Then if we could go to the slide regarding additional data points. I wanted to just make sure, if it's all right to go forward and no one else wants to talk about what we've talked about so far, that there's nothing else that we would like staff to gather. So you can see we're gonna go to the Justice Gap study and look at data about Californians who are disqualified for legal aid because their income's too high. Leah's been trying for a long time to try to gather data regarding location of certified paralegals, and we'll be honing in on getting that to us. And also the local support information or data. But is there any other metric or piece of information that you think would be helpful for you or for the larger group when we're considering these, sort of finalizing some of these decisions as we move forward in the months to come?
Well, just a point that I know that things have been changing with the state bar and legal aid in terms of clients' income level and qualifications for legal aid. So that may bear on this too.
That's a good point.
And like Dwan, if you want to add anything to that.
Sure. So for right now, for our legal aid grants that are administered at the State Bar of California, BIOLTA statute prescribes that clients have to be at 125% or less of the federal poverty threshold. There's a request at the legislature right now to increase that client eligibility threshold to 200%. We're hopeful that that change will happen sometime in this calendar year. It won't take effect though. So depending on how soon this is rolled out, you know, there's going to be some implementation time for that to take effect. But Sharon's right, there are some that would be a big change in terms of client eligibility within the legal aid community.
Okay, thanks, Dwan. Thanks, Sharon. Any other thoughts about data or metrics that we would need or that could be helpful? Okay, so then we'll move on to the next slide. Oh, thanks. We're while our group was not tasked specifically with coming up with the evaluation mechanism, we did talk about evaluation, and we also got some information about evaluation from OSHPAD and other, the Shriver Project and Bonnie. So these are some of the things that we thought we would push forward that bubbled up from our conversation about evaluation factors so that it's memorialized. So some of the things we think an evaluation should take into account is sort of a frequent kind of review, the nature. I'm gonna maybe see if Christopher or Leah want to talk about this slide.
Yeah. Thank you, Joji. So we created this slide from the notes from the most recent meeting and the one just before it. So this is January 26th and February 2nd. So we recorded the most energy among subcommittee members around these categories of data for future evaluation: the frequency, nature and disposition of cases, kind of the core data set. The frequency, nature, and resolution of consumer complaints will be important to evaluating the efficacy of the entire program and its safeguards for consumers. The price, the length, and the outcome of services, perhaps compared to matters that, if possible, comparing that to matters that have self-representation or attorney representation. And then there was also an idea that it would be great to measure sort of the impact, because the first four sort of focus on the client's experience, the impact sort of of legal professionals on the legal system in California as a whole. So for instance, the extent to which legal professionals help keep matters out of court, they improve the efficient administration of justice, and increase compliance with judicial orders. What is sort of implied in here, but could probably be its own bullet point, is for frequency, nature, and disposition of cases, the top one. Because the entire program seeks to close the civil justice gap in California by offering an affordable alternative to expensive legal services for folks who maybe can't get legal aid because they make too much money, just to what extent is it actually lowering the civil justice gap? And the State Bar's justice gap study provides a nice baseline for that future comparison.
Thank you, Christopher. So given that we've talked about some of these factors, we wanted to check in with our group to see if there's other factors or other things we would want to memorialize for future discussions on evaluation and evaluation factors. Anybody have any thoughts on that? I know it's kind of hard because now we're shifting gears. So thoughts about evaluation?
I have a lot of thoughts, but if we are comparing to pro-pers or comparing to taking the same type of population, so modest means folks, and maybe comparing to those who got, like a low-cost attorney from a referral system, are we randomizing that? How are we doing that?
I think I'm sorry, people are doing work outside in my yard, so it's very loud. I think we would leave it to the evaluator to recommend the methodology, but obviously like a randomized controlled trial is the gold standard. I don't know that we would be able to do that because it's sort of rolling dice and I get a paraprofessional and you don't. And I don't think that's the way we're going to be able to do things. So I'm sure there'd be some kind of sampling process after cases have been closed, perhaps. I'm not sure, but through the request for proposal process, we would solicit, recommendations on the methodology.
That's a good question, Sharon. Thank you. Any other thoughts about evaluation factors?
This is Greg. I think, and I know that we still have a lot of thinking to do about the extent to which paraprofessionals will be able to participate in court proceedings. But I'd like to have some mechanism to get feedback from the bench on how they perceive that paraprofessionals are performing in the courtroom and in terms of their filings as well. Even if they're not advocating in the courtroom, are they helping to move these cases along in a more efficient way?
Yeah, I agree with that completely. Any other thoughts? Thanks, Greg.
Just getting direct consumer feedback. So not just looking at consumer complaints and outcomes, but oftentimes consumers, like, they may not get what they wanted in court, but they feel like they were heard, or they feel like they had their day in court and had access to justice. So any measure that gets to that qualitative data, I think, is really important to get the consumer standpoint.
Yes, I think we had even talked about potential exit surveys and things like that. Any other thoughts? I'll work with Chris on this piece of our memo, and Leah and others. Is there anything else that anybody would like to say on the evaluation piece? And was this the last slide, Chris, I think?
Yeah, and that concludes staff's presentation of the data that we have available today.
So I think we did a lot today, but we have a little time. So I just want to go to each person and make sure that they have had a chance to say what they want to say, and that we've accounted for everybody's concerns. So I'm just kind of going to go reverse order of how you appear on my screen now. Fariba, anything you want to add to what we talked about today?
No, thank you for the information.
Okay, Steve, anything?
No.
Okay. Linda, anything?
No, thanks.
Justice Petro?
I'm good. And I just want to say that I'm impressed with the fact that we've made so much progress so quickly.
I take that back. I did have something to say. Sorry.
Okay. That's all right.
Staff, you did a magnificent job getting the data that you got together, the way that was presented to us. You just made our jobs immensely easier. I'm very appreciative of what you did.
Yes, and they worked hard over a holiday weekend and didn't have a holiday weekend. So really very appreciated. Donna, I don't know, did you want to add anything?
No, I didn't. Thank you very much, Chichi.
Okay, sure. Thank you, Donna. Julie?
I also want to thank staff for their enormous quantity of work in a short period of time. This is nuts. I just want to ask a question, and I'm not even a litigator. I'm not a family lawyer at all. On this whole venue issue, the focus on venue as to how we're going to choose geographical limits.
Mm-hmm.
If you have a custody case and one kid is in one county and the other kid is in another county, how does that work?
That's a good question. You
mean, oh, so two children with dissimilar parents in one aspect?
I guess so.
Yeah, like mom has one child, but dad has another, and there's a different dad, or something like that.
Usually,
it could be custody, or it could be support. It could be anything. But there's two different counties, and one's a yes PP county, and the other one is a no PP county.
Then they wouldn't get to. I would think they wouldn't get to do the work in the non-PP county, because they would be two different cases. Very rarely would you see those consolidated.
Okay.
And any other questions, Julie?
No, thank you. Thanks for the answer, Steve.
Yeah. Sharon?
More kudos to Chris. I'm a Chris fan, and staff for teeing this up. I'm also really percolating on unintended consequences. I'm thinking about family law. I'm thinking about those emergency cases. I'm thinking about domestic violence cases where one party has had to flee. But I think we'll continue to think about it, and we've made a lot of progress.
And I said, I'm sorry, I'm jumping in, but I had a question earlier, and I thought it was perhaps too detailed for this discussion, but can the paraprofessional follow the case? And I mentioned a change of venue example. So the concern Julianne brought up is the same. It's like, what if you have these cases where the paraprofessional should be allowed to, at the request of the client, to also assist with the related case? That may be something we want to make a note of and have as an exception to the rule, perhaps.
And I think I always appreciate your comments, Sharon and Reba and everybody, but I think maybe we should have a parking lot, for some of these unintended consequences. And I'm glad you're percolating on it, Sharon, because I'm sure we're going to be coming back to some of these questions, if not in our group, in a larger group. So I'll talk to Chris to see if there's a place, may not be in the memo, but a place where we can just hold some of these questions so we don't lose them.
Well, in a sense, one option might be to hold them in the evaluation factors, because we discussed unintended consequence and housing might be lopsided representation, and that will require collection of data and review of data. Another unintended consequence is that if we're actually impeding access to justice, or we're sort of making things more difficult for people because of our geographic limitations, and that may be something that we could ferret out in the evaluation period as well, and then be willing to tweak, as Sharon indicated, based on the data that we're seeing.
Yeah, and I think we've always said we're committed to flexibility. So maybe that's a place where we can put it in the memo. So Leah, did you want to add anything or say anything else?
No, thank you.
Sure, Greg?
I just want to express my appreciation also to staff. This was I think a wonderful discussion. We really made a lot of progress today. One of the things I would just add around trying to understand how to delineate the geographic limitation is just from a regulator standpoint, what is worth policing and what isn't at a certain point, because I think if we task the regulator with the job of trying to police where the client is and where they're residing throughout the entire matter, the resources that are dedicated to trying to enforce that, is that something that's really worthwhile to enforce, as opposed to what this group has already started to seem to coalesce around, the idea of venue. And that it's a much easier limitation to impose, to say, paraprofessionals, you cannot file any sort of pleadings with your name on it outside of these counties. And that's a lot easier to manage. And then also, as Sharon said, having a robust referral system around that, I think, is very helpful.
Thank you, Greg. Dwan?
Yeah, I was just gonna say, I agree with Greg. I feel like this subcommittee has made a lot of progress. It seems like there's some consensus around the venue. Perhaps we issue some guidelines, but the enforcement aspect of it, in terms of a phased out approach, I don't know if it's worthwhile to invest a lot of efforts into that. I want to piggyback off what Sharon said in terms of having the partnership with kind of the programs that are on hand. So one of the next steps that staff is going to do is that we are going to be reconvening a meeting with the legal aid community to kind of share, preview these recommendations. And as we firm up the recommendations, we'll be in continual communication with the legal services community with the hopes that if this is rolled out in some phase out approach or permanently, that they will be aware of what's coming down, so that we'll have people kind of on the ground reporting back to us in case there are any issues that might percolate.
Thanks a lot, Dawn. And I know you and Leah and Linda worked over the weekend as well. So thank you all so much for your hard work and efforts, and meeting with us, Justice Petro and me, to kind of fill us in and get our thoughts. Thank you. And then Christopher, you're our hero, and thank you.
Oh, my no, that's too kind.
Do you have any final thoughts or words that you want to share?
Thank you for asking. I got to share all of my thoughts during the entire presentation, but thank you.
Okay. Anything else from anybody? Okay, so I know Christopher will diligently finish up the memo. We'll get it to you as soon as possible. And thank you so much for your time and all your thoughts and expertise. It's really great to work with you. So thank you so much, and we'll be in touch with the memo. Take care, everybody.
Thank you.
Thank you. Good afternoon, everyone.
Thank you. Bye.
Bye.